The Honourable Member for Calgary-Lougheed.
Thank you very much, Mr. Speaker. I would like to start with just a few thank yous. One to you for allowing this to occur. I would like to thank the Honourable House Leader for the official opposition for making this motion in the first place. It is apparent not just on this day, but in the past, and I'm sure in the future, his dedication to our future generations is something that's beyond reproach. And I know that's shared by yours truly as a fellow dad, and by, I dare say, every member of this House. It's part of the reason that we're here. I'd like to thank the Honourable Government House Leader for also agreeing to this debate. He didn't have to, but he did. I'd like to thank the Minister of Human Services for rising just moments ago and explaining what is happening with his ministry now. Let's face it, sir, with the greatest of respect, this is something that hasn't just faced you, it's faced previous ministers, and every minister that will come after you will also have to deal with this, sadly, as long as there's the human condition. And it's incumbent upon us. It's our honor, it's our obligation to deal with this as best as possible. I wish you and everyone in your department Godspeed. I also look forward from hearing from every other minister in this government, and I'll tell you why, Mr. Speaker. It's because this is an issue that affects every single department that this government is charged with. So again, I look forward to hearing from the other ministers and the Premier on this, as well as the folks who serve as private members. Mr. Speaker, I am so sad that we are speaking about this here today. Oh, now it's Madam Speaker. Welcome to the chair. I'm so sad that we're speaking about this today because it's too late for Serenity. When I first heard about this, I was bordering on being physically sick. But I can tell you I'm so glad that we're talking about this today because it's not too late for other young Albertans. Madam Speaker, I think just about every one of us has a ribbon on today for National Child Day. And just yesterday, I tweeted out, for Universal Children's Day, children are more important than anything else in our world. Today is Universal Children's Day. I could have written so much more, but it's a tweet. I could have said every day should be Children's Day, but I had room for their rights and a link to them to the United Nations, as well as to our legislature. You know, we're all wearing these here today, but also on our desks here today was the report, the annual report, 2015-2016, from the Office of the Child and Youth Advocate here in Alberta. And I would like to salute them and thank them for doing incredible things. And I'll just do a short list of 10 categories. I want to point out, first of all, did you know, Madam Speaker, in last year alone, a total of 2,535 young people were served by this office. That's 7 a day. No wonder we're speaking about this. This is urgent, not just right now, but every hour. You know, these folks advocate for young people. They connect with experts to better serve younger children. They contribute to systemic advocacy, which is absolutely critical. They speak up about issues affecting young people. They connect people with knowledge. They advocate on children's mental health. They engage with youth in the justice system. They connect with community organizations. They focus on sexual and gender minority youth. And they identify issues at the regional and agency level. And Madam Speaker, on page 20, there are no less than 7 different quotations from youth about how invaluable these services have been for them. I dare say, in many cases, it's actually saved their lives. And I know this tragically from her first-hand experience as well. A few careers ago, before this one, I was honored to serve as an educator and administrator for over 13 years in 3 countries, from kindergarten to university. Started out in the West Indies, went over to Nepal, 2 of the poorest countries on earth. And you know, times are tough here, but holy smokes, you compare it to what's happened in those absolutely impoverished regions and the consequences that incredible poverty wreak. It was heartbreaking. But the heartbreak isn't just overseas, it's within our own borders as well. I've been so sad to see so many terrible things. You know, my first job in Alberta was in Calgary, right after the Calgary Olympics. I was hired as a special educator for what they called the Skills Enhancement Program. That was code word for a holding tank for kids that could not fit anywhere else or people had since cast aside. It included children with severe learning disabilities, children who simply could not speak English. Children had nowhere else to go. And I can tell you, Madam Speaker, there were a number of con artists, serious trouble with the law, very serious trouble with the law, in our classroom. There were prostitutes in our classroom. There were drug traffickers in our classroom. And Madam Speaker, these children were in junior high. That being said, there were some incredible success stories because of what they did and because I was fortunate enough to have a little bit of luck in partnering with a bunch of wonderful people in the community, often without the parents or in spite of them. God bless them. You know, time in senior high school, they actually created a position called Youth Ministry Coordinator. For some reason, they asked me to help out there in the classroom, in private counseling sessions, and in the community. And the abuse that I saw was of every kind. You know all the categories, ladies and gentlemen. I won't go through the list. Yes, there were success stories. We reached a lot of kids and helped a lot of them. But for some of them, they were too far gone, and the results were catastrophic. I guess I'm pointing out, Madam Speaker, that wherever we are, whatever the age, this is happening. It's happened in the past, it's happening now, and it's going to happen in the future. We need to not only talk about this, we need to continue to do more different and new things. You know, when it came time to be in government, I was so honored to be the chair of the Alberta Alcohol and Drug Abuse Commission and also the Minister of Wellness. And, you know, we started some great programs that helped a lot of people with healthy eating and active living and helped a lot of folks with education and treatment when it came to addictions and mental illness. You know, back then it was crystal meth, now it's fentanyl, it's other things. This is often life and death for folks. And it really is. You turn to Appendix A in the report aforementioned. 16-year-old Sam. 9-year-old Benita. 6-week-old Nicole. 8-year-old Ella. 17-year-old Catherine. 2-year-old Tiana. 17-year-old Michaela. 10-month-old Lily. 14-year-old Asane. 15-year-old Sage. 18-year-old Cedar. 15-year-old Morley. 15-year-old Carrie. 15-year-old Victoria. And 18-year-old Jacob. We had our little friend last week. I shudder to think who it might be today, tomorrow, next week, next month, next year. Who knows what will happen next? Who knows when? Who knows what will they undergo? Madam Speaker, it is a life and death issue. And if even one death or even serious injury can be avoided because of what happens here today, this was time that was extremely well spent. So, with the few seconds I have left, as PC House Leader, MLA for Calgary-Lougheed, as an Albertan and just as a dad, I urge everyone in this chamber, minister, and every Albertan to do everything possible to make sure that we have the skills to be the best parents we could possibly be so we could pass on the best life lessons that we can to our children so they can experience success of every kind, which really is not only the opportunity but the right of every child, not only within our borders, but within Canada and beyond. God bless Alberta, and God bless our little Albertans. Thank you.